The forgotten pandemic, the Spanish flu of 1918 to 1919. Throughout history, we've seen some truly heartbreaking moments, wars, revolutions, and disasters that we all remember. But what about those events that were so impactful yet seem to slip through the cracks of our collective memory? Take the Spanish flu of 1918 to 1919, for example. Can you believe this pandemic wiped out around 50 million people globally? It wasn't just a tragic moment. It completely changed how society operated, influenced healthcare, and reshaped our everyday lives. How can something so monumental be so easily forgotten? Let's dive in and explore this fascinating piece of history together. The world of 1918 was already in turmoil. For 4 years, the First World War had ravaged Europe, claiming millions of lives and leaving landscapes and nations irreparably scarred. Cities were in ruins, economies were crumbling, and countless families were grieving. It was in this fragile, exhausted world that a new and invisible enemy quietly emerged. In the spring of 1918, the H1N1 influenza virus took its first breath, though its exact origin remains a subject of debate among historians and scientists. Despite its name, the Spanish flu did not originate in Spain. The pandemic earned its misleading moniker because Spain, a neutral country during World War I, reported its cases openly while other nations suppressed news to maintain wartime morale. This lethal virus would go on to infect 1/3 of the global population, making its presence felt in almost every community, every home, and every corner of the planet. The Spanish flu arrived in 3 distinct waves, each more devastating than the last. The first wave began in the spring of 1918, spreading quickly but appearing relatively mild in comparison to what was to come. Soldiers, crowded into trenches and transport ships during World War I, became efficient carriers of the virus, unknowingly propelling it across borders and continents. By the summer of 1918, the second wave emerged as a far deadlier iteration of the virus. It struck with unprecedented ferocity, overwhelming the world in what seemed like a tidal wave of death. Unlike most influenza outbreaks, which tend to claim the very young and the elderly, this virus targeted a demographic in its prime, healthy young adults aged 20 to 40. The third wave, arriving in early 1919, added yet another layer of devastation before gradually subsiding later that year. By the time the pandemic had run its course, some 50 million people had perished, with even conservative estimates placing the death toll at 20 million. To put this in perspective, the Spanish flu killed more people in a single year than World War I did in 4. The suddenness and severity of the Spanish flu caught the world entirely off guard. Unlike today, there were no vaccines, antiviral treatments, or modern medical practices to combat the virus. Cities imposed quarantines, mandated mask wearing, and shut down schools, churches, and businesses. Public gatherings were banned, and signs reading "Spit spreads death" appeared in cities like Philadelphia in a desperate attempt to curb the virus's transmission. Hospitals overflowed as healthcare workers struggled under the weight of an unprecedented crisis. Many doctors and nurses died while caring for the sick, becoming unsung heroes in this grim battle. Makeshift hospitals sprang up in gymnasiums, theaters, and open fields as the world scrambled to keep up with the surge of patients. The tragic consequences of the pandemic were both communal and deeply personal. Entire families were wiped out in the span of weeks. In some cases, there were not enough coffins to bury the dead, forcing communities to dig mass graves. Beyond the statistics and policies lies the very human story of the Spanish flu. Personal accounts reveal the terror and heartbreak of those who lived through it. Families struggled to provide even basic care for the sick, fearing they too might contract the disease, a sentiment eerily familiar to recent generations. One particularly poignant account recalls the experience of a small-town nurse who worked tirelessly, even as she watched her own family succumb to the illness. Hers was a story of sorrow and resilience, a reminder that the human spirit often rises even in the face of unimaginable grief. These stories, though silent for decades, continue to carry emotional weight and offer deeper insight into a profoundly challenging time. The Spanish flu serves as a historical parallel to modern pandemics, most notably COVID-19. Mask mandates, social distancing, overwhelmed healthcare systems, and even misinformation. These challenges are not new. In 1918, unfounded rumors about the virus's origins and spread fueled panic, much like the misinformation seen during recent global health crises. A century later, society grappled with similar emotions: the fear of the unknown, the grief of collective loss, and the undeniable importance of scientific discovery. Where modern medicine eventually developed vaccines for COVID-19, communities a century earlier had to confront the Spanish flu with little more than hope and crude remedies. These parallels remind us how far we have come, and yet how fragile we remain in the face of nature's might. As devastating as the Spanish flu was, it spurred remarkable progress in medicine and public health infrastructure. The need for better disease tracking and prevention inspired the establishment of organizations like the World Health Organization decades later. Advancements in vaccinology, hygiene practices, and healthcare systems were also part of its enduring legacy. Perhaps one of the most important lessons is the value of preparation and collaboration. The Spanish flu showed humanity that global health crises do not respect borders, nationalities, or economic statuses. It also underscored a simple truth: in such crises, we are all bound by our collective fragility and by a shared responsibility to protect one another. Despite its colossal impact, the Spanish flu has often been overshadowed by the events of World War I and the Roaring Twenties that followed. Unlike the visible scars of war, the pandemic left no grand monuments or commemorations. Its toll was largely private: lives lost in silence, grief expressed behind closed doors. This lack of remembrance may also be due to the sheer emotional toll it inflicted. Grieving societies were eager to move forward, perhaps at the cost of forgetting lessons from the past. It is only through historical reflection that we can bring the Spanish flu back into focus, ensuring its lessons are not lost to time. By late 1919, the Spanish flu's death toll began to wane as immunity grew and the virus mutated into a less deadly form. It didn't disappear, but instead faded into the background as life resumed. The survivors carried with them scars, not just physical but emotional, as entire countries mourned their fallen. This marked the end of a pandemic that claimed millions, even in the absence of modern transportation and global connectivity. What had started as a single virus in an unknown corner of the globe became one of the most profound events in human history. The Spanish flu of 1918 to 1919 is not just a story of death and suffering. It is also a testament to human resilience. In the darkest moments, individuals and communities found strength. As we confront contemporary challenges, from pandemics to climate change, the Spanish flu reminds us of three enduring truths: we are fragile, we are connected, and we are capable of enduring more than we imagine. History offers lessons, but only if we choose to listen. The Spanish flu may belong to a century gone by, but its echoes remain in every pandemic, every outbreak, and every ripple of global health challenges we face today. By remembering, we honor the past while forging a stronger, more prepared future. The story of the Spanish flu is one of tragedy but also of hope. Even in the wake of immeasurable loss, life continued, the world rebuilt, and humanity endured. Let this reflection on a forgotten pandemic inspire us to build a world that values knowledge, resilience, and compassion. The past may be silent, but its lessons speak loudly if we listen.